for a medical practitioner's view on this latest surge and how significant it is, and whether in medical terms it is a risk?
That's a conditional question. Depends what perspective you're looking at. If you look at a healthy young adult's perspective, if a bout of COVID occurs, it's very unlikely that person will end up in the hospital. 1 out of 20 of them will go on to get long-term health problems, which is termed long COVID, which includes things like tiredness, breathing trouble, confusion, loss of memory, and mobility issues. So that is called long COVID. So that's a 1 in 20 chance of 5%. I'm giving you the conservative estimate. Higher estimates are also circulating. So that is the standpoint of the healthy individual. But from the standpoint of an older person, let's say over the age of 60 or 65, or somebody who has significant underlying health condition, for example, heart failure or chronic obstructive pulmonary disease, which basically means a bad lung, a bad liver, or a diseased kidney. Yes, these individuals could get destabilized from the COVID infection and require hospitalization. And some of these people may have bad outcomes. For the most part, when these people are being admitted to hospital now, they are getting better quickly and are being sent home in good condition. So that's a good part. But we do not want this variant, which is fast spreading, to go deeper and deeper into the community where more and more frail individuals might get affected. Right now, most people who are affected include those who are relatively healthy, who can travel, who are well enough to go to work, study, or otherwise. Among children, the chance that COVID will cause severe disease is actually very, very small, except if the child has very severe neurological or other underlying health conditions.
Dr. Jayadevan, in the past when we saw variants come in, there was a certain kind of impact. And this time round, one of the key facts that experts are pointing out is the level of vaccination in India. A double dose, which a vast majority of Indians have a double dose, and many have had a booster dose as well. So, regardless of the severity and the speed of spread, uh, is the level of vaccination our greatest safeguard, according to you?
It really is. Vaccination protects against a disease broadly along two separate lines of defense. The first is called antibodies, and the other is broadly can be called as cellular immunity or T cells. Now, the two operate separately. It's like the army and the navy, right? So the antibodies uh, target certain proteins on the body and spike of the virus, and they can be fooled as the virus continuously makes changes. For instance, this JN.1 strain is markedly different from anything that circulated commonly in the past. So that is why people are watching it very carefully with substantially more interest and respect and a level of uncertainty than most recent variants that were mere mild alterations from its predecessor. The second line of defense in our immunity is called the T cells, and they cannot be fooled so easily by the virus. So, in other words, the vaccination has created a broad immune memory that will protect us in the long run, regardless of the variant. So, that is the currently held belief. That is the reason why, even after Omicron and its sublineages subsequently affected very large numbers of people, we did not see the horrendous outcomes that were seen in the first half of the pandemic. And a good reason for that is the immunity that is acquired by fast rollout of vaccines. And I must also mention that there are many people who perished in the first half of the pandemic. Those who did not die in the first half of the pandemic, despite an infection, went on to develop what is called a natural immunity. In other words, natural immunity, even though it's casually mentioned, came at a heavy price of millions of people's deaths.
What should be ideal behavior at this point of time? Because we have also seen earlier during this year, especially in North India, and we are based out of the NCR, a weather change and the normal cold that we used to see suddenly is far more severe this time. And we have seen pneumonia also claim victims. earlier during this year. What should the average individual do, perhaps starting with being masked up?
Yes, I would like to add that many people see the impact of COVID through parameters such as deaths that are reported in the media. I would say the impact of COVID on a country's economy, although I'm no economist, I'll say that the productivity angle is significantly impacted when a person is not able to go to work. That has an effect on the economy, and when 1 million people can't go to work, at least even if it's for 3 days, it has a substantial impact on the economy. So that's something that we should not discount. Frequently, I hear casual statements saying that nobody is dying, people are not dying like they did before, almost like a complaint, and that therefore COVID is not important. No, COVID is a fast-spreading virus. It can reach enormous numbers in very little time, and can incapacitate people to such an extent that can cripple the economy. So that is something I would like to add in this context. So in terms of individual precautions, I always say that if each one of us can do a little bit, especially during times of increased spread of such viruses, then it will help a great deal to reduce the overall impact of this disease on society at large. For starters, we know how it spreads. It does not spread by coughing or sneezing. It spreads when people talk or when people breathe out what we call aerosols, which is basically a mist-like substance that emit out of our breathing, and it increases when people talk. So it's a weightless series of droplets. The closest equivalent is mist. We've all seen mist. You can't see it up close, but from far you can see it. But mist is made of tiny, weightless droplets of fluid in which viruses are embedded, and they use these droplets to travel from person to person. So, wearing a mask in such a setting, for example, a crowded, ill-ventilated indoor setting, is an effective way of reducing our own risk of infection. And also, God forbid, we have an asymptomatic infection. Say, a lot of people are carrying the virus without feeling ill. So such people might go to work, and if that person is wearing a mask, yes, they are less likely to infect the person next, standing or sitting next to them. So these are simple techniques. So it's not about masking the entire country. It's about using masks where it is where common sense actually indicates its use. For example, you're traveling in an elevator. The elevator stops or the lift stops at every floor in a 10-story building. Imagine it has 15 people standing inside it. It's crowded.
Right.
One of them has infection, other people are going to get it. If you're wearing a mask, you're well protected. Likewise, you're sharing a ride in a cab with strangers. Wear a mask. It'll keep you safe. So that is the kind of individual input we can do. And secondly, stay home if you're having a fever or a cold. Please don't go and spread it around to other people. And thirdly, avoid social visits to hospitals. In India, I see this culture of people visiting hospitals to see their near and dear who are admitted. No, hospitals are not the place to make social calls. Only essential bystanders should be there in the hospital.